Hello, everyone, and welcome to our first official Insight Tuesday. And for those that have no idea what this is, Insight Tuesday is going to be something that is held every single Tuesday. And I will be speaking about one RHIA concept that is important for you to know for the RHIA exam. This time is only going to be for 30 minutes. So I will log off exactly at 30 minutes. So if you have other obligations after this time, you'll be able to go ahead and do that. But we're going to spend this time talking about a topic. One more thing before I start. No, this is not going to be highly detailed. If you want a very extensive RHIA experience, then I do have courses and things available. This is just going to be a quick little snippet for those that just want some assistance while they're studying. So I'm just going to go ahead and start because in the next 30 minutes, I'm going to hop right off of here. So let me share my screen and let's go ahead and get this first Insight Tuesday going. So I'm going to share my screen here and a concept that is very, very popular on the RHI exam and as well the RHIT for those that are prepping for that. And that is SOAP notes. And understanding not only what a SOAP note is, but also at the same time, understanding the parts of a SOAP note and being able to also point out the areas that represent each acronym of the word SOAP. So that's going to be our topic for today, right? So I'm going to go ahead and let's talk more about what exactly a SOAP note is. If you don't know what a SOAP note is, please take notes. You want to make sure that you understand what a SOAP note is. It is very important for your RHI exam. So what is a SOAP note exactly? A SOAP note is a structured method of documenting patient encounters in healthcare settings. And what it does is it does actually facilitate clear communication. It helps with the continuity of care, and it also provides evidence-based decision making for healthcare providers. As you're studying for your RHIA, you're going to learn that there are loads of reports and documents that are used by clinicians in order to prove what they're actually treating the patient for. There's progress notes, there are longitudinal records, there's all these different types of reports and things that you need to understand. But the SOAP note is one that you're going to definitely want to fully have a good grasp on. Okay, so SOAP note. What does an actual SOAP note look like? I'm going to show you right now. And hopefully this will help you guys to fully see why this note is so important for healthcare. So I'm just going to go ahead and stop my share here. And I am going to pull up an example of okay. All right, and this is my example. I'm going to share my screen one more time so that you guys can see it. All right. All right, and here it is. So this is a basic example of a SOAP note. Where did I get this document from, guys? It's online. It's not hard to find examples of these. So as you're studying, I would say to my students, please make sure that you use Google to your best because there are plenty of things that you can find additional information on using Google. Don't trust everything, but you can trust this document that I'm showing you. So what does SOAP actually stand for? SOAP stands for subjective, objective, assessment, and plan. And how this note works is that each letter represents a particular part of a patient's visit. And so here, for example, we have the S section here, and it's labeled subjective. And you can kind of see the language that they have here. It's saying this blank is, year-old female or male is presenting here for this reason. You'll see history information, past medical history information, current medication, medication allergies, social history, family history. So these are common items that are found in the subjective area. Now, how do they decide what is in each area? We are going to talk about that because you need to know that for this exam. These are very easy questions to pick out a particular line from this section and say, hey, what part of the SOAP note are you currently looking at? That's a very easy question that I don't want you guys to get wrong, okay? So we will talk about how to pick this information out. So this is the subjective or the S section of the note. I'm now going to move down here to the O. And like I mentioned before, this stands for objective. Okay, so this is now going to be a time where there is some type of assessment being done on the patient. So the skin, it's good. There are no rashes. There are unusual bruising, normal color. These are all just descriptions of what that provider or clinician is seeing about that patient. That is the unique trait of the objective or the O section of SOAP. Okay, so I'm showing this so that you guys can kind of see exactly what these notes look like outside of the exam, because it will help it stick better. Okay, we're gonna quickly move down here to the A, and A stands for assessment. You also want to know what A stands for. That's a very easy question for your exam. And it also just kind of explains the actual diagnoses provided by the actual provider and just some information that is documented from the actual clinician. Good question. Which domain is this found? So as far as where they can test you on this, I would say domain 1 is where you would see questions. You may see some questions about this in domain 3. If you're studying for your RHIT exam, for those that are taking the RHIT who may be on here, you can also be tested on this as well for your RHIT. It would probably be in either domain, I want to say domain 1 is what I want to say, if you are studying for your RHIT. So for my RHIA people, domain 1, domain 3. For my RHIT people, then it would be domain 1. Good question. Good question. And then P here is going to be your final one here, and that's going to be the actual plan. Okay, so this is just how the actual note looks. Now, we're going to break this down even further, but I want you guys to get this concept in your head, because I guarantee you that you will see one question where they will ask you something about the SOAP note, and I don't want you guys to get this wrong. Okay, so definitely check this out. I'm actually going to place the link of where I got this from in the chat for those that would like to just have this, because I think it's just a really good example. And if not, there are plenty of these online, guys. You can find plenty of these reports to kind of study off of. So use. So let me quickly stop my share. I'm going to go back to my notes here, and let me share this link for those that want to have access to this example. I think it's a really good report. I put that in the chat for those that want that. And let's now go ahead and go back to the notes, and let's talk more about what all of these letters stand for, because this is going to matter. And we're also going to do questions as well towards the end about these concepts. So stay tuned for some practice questions to see how you guys do on this, okay? So let me share my screen one more time. Let's see. All right. And can you guys see my screen yet? I don't think you guys can. No, I don't think you can. Okay, let's try this one more time. Okay, my screen may have froze, so I'm just going to ad lib and just speak and discuss the details of this while the computer gets back here. So for S stands for subjective, okay? And I'm gonna pull this up really quickly. My screen just froze on me, but that's not gonna stop this show. So let's make sure that you guys get this information. So S stands for, like I said, subjective. So subjective is going to be the information that the patient actually tells whoever is receiving them when they come in. So when they are showing up to the hospital to be treated, whatever they say that they are feeling, they have a headache, they are 30 years old, all those details are very unique because it's coming directly from the patient. That's the patient's point of view. Subjective, okay? So when you see a question that will ask you or show a phrasing that came from a patient, it's a good recommendation to pick subjective because that's something that the patient told the facility, okay? So you will always see that information in the subjective section. O stands for objective, and that's gonna be the measurable, observable, and factual data that is actually gathered during their clinical examinations. So for those that are here and are able to click on that link that I put in this chat, you will see that all of the different information that's on there are things that a clinician, normally like either a nurse practitioner or maybe a medical assistant or someone, has pretty much analyzed and studied the actual patient and is writing out or typing out the things that they notice about the patient. So things such as them having a increased heart rate, them having a decreased breath sound in their left lung base. Those are just some examples, but it will all be physical examination traits that are not spoken to from the patient as in subjective, but rather from the actual clinician, what they notice, okay? A, assessment, right? So this is gonna be where the healthcare provider is going to be then adding in their feedback and their professional judgment based off of what they have received from the patient, right? The subjective, and then tying into the subjective what the physical examination showed. So S plus O is going to help me create my assessment, or A. So the physician is going to be the person that will be responsible, or whoever that, clinician will be the person responsible for creating that assessment. Okay? So we have S, subjective, we're thinking about the patient. We have O, objective, that's going to be your physical examination. And then you have A, which is going to be your assessment that is done by the provider. And they're going to put in what they want to diagnose for the patient. So the actual diagnoses as well will go within that assessment section. And then from there, you're going to have your P, right? Which will end the word SOAP, and that's going to be your plan. So that's going to be the provider's course of action or treatment plan for that patient based on their assessment. So it starts from the beginning of the examinations all the way to how we're now going to treat that patient. Okay. So SOAP, subjective, objective, assessment, and plan. Okay. Does anyone have any questions for me about this information? We have, I want to say, about 15 minutes left, and I want to make sure if you have any questions about SOAP notes or about the RHIA in regards to SOAP notes, now is your